Hello, my name is Nahil Elias, and I'm the Surgical Director of the Kidney Transplant Program at Massachusetts General Hospital. I'll be talking about the surgical procedure of kidney transplant and some of the complications associated with it. The kidney transplant procedure is performed in the lower abdomen, right above the groin, as you see here on this incision. The patient's own kidneys are higher up in the flank area, but we connect the new kidney lower down in the pelvis. When we connect the kidney, we connect the artery, which is the blood vessel that brings blood to the kidney, the vein that brings blood out of the kidney, and then the ureter, which is the tube that carries the urine from the kidney to the bladder. The artery and vein are connected to the vessels that are going to the leg, and the ureter is usually connected to the bladder, as you see in here. Most of the time we do the kidney on the right side, but it could be done on the left side as well. Kidney transplant procedure is about a 3 to 4 hour procedure. Every patient is under general anesthesia, will be asleep during the procedure. We don't usually take out their patient's own kidneys or the native kidneys, except in certain situations where there is a good reason to remove them. Following the procedure, the patient is in the post-anesthesia care unit or the recovery room. Rarely patients require intensive care unit stay. But usually after the recovery room for a few hours, the patient will go to the transplant unit, which is in the Blake building on the 6th floor. When the patient wakes up from the operation, they will have an incision about 6 to 8 inches, depending on their size and the size of the kidney. It's in the lower abdomen, and it's usually covered by dressing. Every patient will have a catheter in their bladder, which we call a Foley, and that stays in for about 2 to 3 days. Every patient will have intravenous catheters or IVs in their arms, rarely in their neck. Patients will have some pain and will be given pain medication to control it. Rarely we use drainage tubes around the incision and stents inside the kidney go into the bladder. The average patient stays in the hospital 3 days. They will be given pain medication for the first night intravenously, but then pills starting the next morning. They will be given immunosuppression medication that starts usually before the operation or during the operation. They can start taking some liquids by mouth the first day after the procedure, and that will be advanced to regular food as they tolerate it. Mobilization is very important, and we will help every patient to get out of bed the next day after a procedure. They will also get a lot of education about their transplant. Rarely kidneys may not work right away, and some patients require dialysis, which usually is a few days to a few weeks. Even if the patient was not on dialysis before the transplant, they may need dialysis afterward. The patient in that situation will go back to their home dialysis units after their 3-day hospital stay. And as the kidney starts working, they will need less and less dialysis, and usually will stop it after some time. There are potential risks and complications associated with any procedure, and similarly with kidney transplant. Some of these risks, well, first, pain. Every patient will have some pain at the incision. Rarely hernia does happen at the incision, but that usually is much later after the procedure. The kidney transplant may not work, as I mentioned earlier, and the patient may need to resume or initiate dialysis. There's a risk of bleeding with any procedure. Very rarely patients need blood transfusion following the kidney transplant. Blood clots are the other extreme to bleeding. They could happen in the legs, in the lungs, or rarely in the transplant kidney vessels. Any of these complications, especially bleeding or blood clots, if it's serious, the patient may need to go back to the operating room for a re-exploration to take care of that problem. Occasionally we do that for urine leak or a lymphocele, which is a collection of fluid around the kidney, if that is causing a problem with the kidney. Infection is always a risk with any procedure, especially in the wound. It could be elsewhere. With a kidney transplant, what's special is the possibility of acquiring infection from the donor. There are certain types of infection that we will be checking for routinely after kidney transplant. There are also certain medical complications like having high or low blood pressure, which may require specific treatment and rarely require intensive care unit admission. Heart problems are a possibility, and this is why we do the thorough evaluation of every patient going into transplant. Our concern is heart attacks, abnormal heart rhythm, atrial fibrillation or others, or heart failure with fluid accumulation. Rarely, lung problems like an infection in the lung, which we call pneumonia, or fluid buildup in the lung, which is called lung edema, are possible. Some patients may require a breathing tube or an endotracheal tube because of the lung problems they have, and then they will need to be on the respirator. Very rarely they require a tracheostomy. Stroke is also a complication of any possible procedure, and rarely, if any of these problems are severe enough, there is a small and very, very small risk of death associated with kidney transplant.